Social policy. Part 1. Social policy, concept and definitions. Social policy refers to the guidelines, principles, and interventions designed by governments or institutions to promote social welfare and address societal issues such as poverty, unemployment, education, and healthcare. Definitions. David Gill, social policy includes principles, legislation, and actions that influence the living conditions conducive to human welfare. P.D. Kulkarni defines social policy as a set of principles and guidelines aimed at ensuring social welfare and development. Richard Titmus, social policy is concerned with the redistribution of resources and opportunities to promote social justice. Malcolm Weiner describes social policy as the collective interventions affecting the social welfare of a population, including public policies on health, education, and income distribution. Characteristics of social policy. Welfare-oriented, aims at enhancing people's well-being. State-driven, often formulated and implemented by governments. Dynamic, changes with socio-economic and political developments. Redistributive, focuses on equal distribution of resources. Inclusive, addresses the needs of marginalized and disadvantaged groups. Goals of social policy. Equity and social justice, reducing inequalities in society. Social integration, promoting unity and reducing social tensions. Economic development, ensuring economic growth with equity. Social welfare, improving the quality of life for all citizens. Human rights protection, safeguarding rights and dignity. Scope of social policy. Health policy, ensuring healthcare access and quality. Education policy, promoting literacy and learning. Employment policy, addressing labor rights and job opportunities. Housing policy, providing affordable and safe housing. Social security policy, ensuring pensions, benefits, and welfare services. Models of social policy. Residual welfare model. Welfare is seen as a safety net for those unable to support themselves. Focuses on minimal state intervention, emphasizing family and market responsibility. Example, USA's approach to social welfare. Industrial achievement performance model. Welfare is linked to individuals' contributions to society. Benefits are based on work performance and merit. Example, employment-based social security schemes. Institutional redistributive model. Views welfare as a fundamental right of all citizens. Promotes state responsibility in ensuring equitable distribution of resources. Example, Nordic welfare states like Sweden and Denmark. Social policy in India. Principles guiding social policy in India. The Indian Constitution provides a framework for social policy through the Directive Principles of State Policy, DPSP. Article 38 ensures social justice and minimization of inequalities. Article 39 focuses on economic justice, equal pay, health, and opportunities. Article 41 guarantees the right to work, education, and public assistance. Article 45 provides for early childhood care and free education for children. Elements of social policy in India. Political element, laws, governance, and policies ensuring democracy and rights. Economic element, policies on employment, poverty alleviation, and economic equity. Social element, welfare programs for healthcare, education, and marginalized communities. Policies related to women. 1. Historical perspective. Women's policies in India have evolved from welfare-focused, pre-independence, to rights-based, post-independence, and empowerment-oriented, recent years. Major milestones include the National Policy for Women, 2001, and gender budgeting initiatives. 2. Objectives. Promote gender equality and women's empowerment. Ensure women's safety, health, and financial independence. Improve access to education, employment, and social welfare. 3. Important policies and schemes. Indira Gandhi Matritva Sahayog Yojana, IGMSY, maternity benefits for pregnant and lactating mothers. Swalamban, economic empowerment of women. Beti Bachao Beti Padhao, addresses declining child sex ratio and promotes girl education. Swadhar Grey Scheme, shelter and rehabilitation for women in distress. Nandgar Yojana, focus on early childhood care and education. Sukanya Samriddhi Yojana, small savings scheme for the girl child. Pradhan Mantri Matru Vandana Yojana, maternity benefit scheme for working women. Pradhan Mantri Ajwala Yojana, free LPG connections to poor women. STEP, support to training and employment program for women, skill training for employment. Shebox Portal, online platform for sexual harassment complaints. Pradhan Mantri Mahila Shakti Kendra, women empowerment at the grassroots level. B. Policies related to children. 1. Historical perspective. Early child welfare policies focused on nutrition and primary education. The National Policy for Children, 1974, marked a rights-based approach. Recent policies focus on child protection, education, and health. 2. Objectives. Ensure child rights and protection. Improve nutrition and early childhood care. Enhance access to quality education. 3. Important policies and schemes. Rajiv Gandhi National Creche Scheme, support for working mothers. Integrated Child Protection Scheme, ICPS, protection for vulnerable children. Bal Bandhu Scheme, focus on child labor and trafficking prevention. Integrated Child Development Services, ICDS, nutrition and education for children under 6. Scheme for Adolescent Girls, SEG, empowerment and nutrition for adolescent girls. Rajiv Gandhi Scheme for Adolescent Boys, Saksham, skill development for boys. Poshan Abhiyan, National Nutrition Mission for Children and Mothers. C. Policies related to differently abled persons. 1. Historical perspective. The Persons with Disabilities Act, 1995, was a major milestone. The Rights of Persons with Disabilities Act, 2016, expanded the scope of disability rights. 2. Objectives. Promote inclusivity and accessibility. Provide financial support and skill development. 3. Important policies and schemes. Deen Dayal Disabled Rehabilitation Scheme, DDRS, financial assistance for NGOs working for disabled persons. Sugamaya Bharat Abhiyan, Accessible India Campaign, accessibility in public buildings and transport. Unique Disability Identification, UDID, project, digital disability certification. D. Policies related to senior citizens. 1. Historical perspective. National Policy on Older Persons, 1999, emphasized care and support for the elderly. Maintenance and Welfare of Parents and Senior Citizens Act, 2007, mandated financial support. 2. Objectives. Ensure financial and social security. Provide healthcare and livelihood support. 3. Important policies and schemes. Rashtriya Vayashri Yojana, free aids and appliances for senior citizens. Pradhan Mantri Vya Vandana Yojana, pension scheme for senior citizens. E. Policies related to education. 1. Historical perspective. The Right to Education, RTE, Act, 2009, ensured free and compulsory education. New Education Policy, 2020, emphasizes skill-based and digital learning. 2. Objectives. Improve literacy rates and education quality. Bridge socioeconomic gaps in education access. 3. Important policies and schemes. Rashtriya Uच्चतर Shiksha Abhiyan, RUSA, higher education funding. Sakshar Bharat, adult literacy program. Rashtriya Madhyamik Shiksha Abhiyan, RMSA, secondary education improvement. Midday meal scheme, nutritional support for school children. Sarva Shiksha Abhiyan, SSA, universal elementary education. Pad Bharat Bada Bharat, early literacy and numeracy. Ek Bharat Shrestha Bharat, national unity through education. UDAN, giving wings to girls, STEM education for girls. Unnat Bharat Abhiyan, rural education and development. Swayam, online learning platform. Institute of Eminence, IOE, world-class institutions in India. F. Policies related to health. 1. Historical perspective. Health policies have transitioned from communicable disease control to universal healthcare. National Health Policy, 2017, aims at accessible and affordable healthcare. 2. Objectives. Provide universal healthcare coverage. Reduce maternal and infant mortality. 3. Important policies and schemes. Rashtriya Swasthya Bima Yojana, RSBY, health insurance for BPL families. National Rural Health Mission, NRHM, rural healthcare improvement. National Urban Health Mission, NUHM, urban healthcare. Rashtriya Arogya Nidhi, RAN, financial support for critical illnesses. Janani Suraksha Yojana, maternal health incentives. Janani Shirshu Suraksha Karyakram, free maternal and newborn care. Mission Indradhanush, immunization program. Evan, Electronic Vaccine Intelligence Network, vaccine supply chain management. Pradhan Mantri Surakshit Matritva Abhiyan, free pregnancy checkups. Ayushman Bharat, universal health insurance. Nikshay Pasan Yojana, NKY, TB patient nutrition support. G. Policies related to SC, ST, and OBC. Important schemes and policies. Venture Capital Fund for SC, financial support for SC entrepreneurs. Rajiv Gandhi National Fellowship for OBC, education support. Dr. Ambedkar Scheme for interest subsidy on education loans for OBC, overseas education loan subsidy. Van Bandhu Kalyan Yojana for ST, tribal welfare. Pradhan Mantri Adarsh Gram Yojana, PMAG, model villages for SC communities.
Thank you so much for watching. Don't forget to like, share and subscribe. See you in next video.